Now, when you think of the flu, most of us think about being miserable. The stuffy head, the upset stomach, all that, the hot and cold flashes, it's terrible. We don't think about dying necessarily.
No, but so far this flu season, the virus has killed at least 4 people in our area. Tonight, ABC 15's Madeline Montgomery is taking a closer look to find out why it's not just the elderly and parents of young children who need to take these symptoms seriously.
Trey, state health officials say the flu has killed at least 15 people across the state in the last few months. I spoke with a doctor who says the way to keep the flu from turning deadly is for doctors and patients to recognize the signs. What can start as an annoying cough can escalate fast to a case of flu there's no recovering from.
What makes it nasty is that it triggers the immune response much more aggressively, and something that we call sepsis, which is something most people have heard of. What that means is that it's an overwhelming response of the body to an infection.
Sepsis lowers a person's blood pressure while increasing their heart rate, and the body can't keep up with the blood movement.
It leads to death with what we call multi-organ failure, which what that means is many of the most important organs in the body, the brain, the heart, the lungs, just stop functioning.
And sepsis can happen to people at any age. This flu season, California's Department of Public Health officials say 27 people under the age of 65 have died from the flu.
Even with aggressive medical support in the intensive care unit, some of those people still die, even if they were young and had no other health problems.
That's because some people are genetically built to react strongly to certain strains of the virus.
What you can do is make sure you're paying attention to your family members, and if they're starting to look sicker and really looking bad, where they really can't get out of bed, physically can't, or are having trouble breathing, or acting confused, these are all signs of septic shock. They need to get to a hospital right away.
Because the sooner you seek treatment, the more likely you are to survive.
All of our efforts right now are focused on recognizing it early, calling it early, and starting the treatment as soon as possible.
One way to tell if you're experiencing a dangerous case of the flu is if you feel worse rapidly.